But now my presentation will be in English. First of all, I want to mention my colleagues who helped me in the presentation, preparing the presentation. First of all, Nathalie Lehouk, who is in chief of the educational program at the foundation, and Dr. Ferber, who is a psychiatrist, is not here today, and is from Luxembourg and work directly in the foundation. When they asked me to prepare this presentation, I must tell you that, well, thinking about the location in Sicily, I said I must do a very Sicilian presentation. So that's it. I thought about some images from my memories about the Greek mythology of Scylla and Charybdis, two sea monsters that used to live on the opposite sides of the little street of sea, the street of Messina, that divides Sicily from the rest of Italy, that was very difficult for sailors to pass through. It's a very difficult part of sea because there are a lot of currents and whirlpools. And according to the Greek mythologies, these two sea monsters used to kill a lot of sailors. Anyway, to pass through that street was very difficult. Thinking about our families, thinking about our experience, we are traveling in a very strict way in the treatment of autism. And I believe that many of our families do find very difficult to get a balance between, on one side, the sea monster Scylla, which is the behavioral problem, almost, and on the other side, the medication treatment with all the side effects, all the problems connected to the use of medications anyway. So, if we look at the mythology, we find that, anyway, we have three heroes who tried to pass through, and did pass through the street. One is Odysseus, Ulysses, who did pass through, but he decided to go very near to one of the monsters and lost a lot of sailors. And this is what often happens to our families, to decide to get into medications and get a lot of problems related to the use of medications. Another one was Enea. Enea decided to avoid the street. And this perhaps is the hope that we can all have in new frontiers of medicine. Pharmacogenetical, Dr. Fuentes spoke about before. And perhaps that will be the way to get to the foundation of Rome, of a new Rome. And at the end, and this is what I want to speak about, is the way of Jason looking for the golden fleece. Jason, thanks to the help of Hera, got through the street, finding a good balance between the two monsters. So let's see what we have tried to do at the foundation. Just something I would like to focus on is that I'm a psychiatrist and I work on adults, and there is a lot about children. No, really, there's not enough about children and medication, and Dr. Fuentes just said, but there is even less about adults. This is an important work for 2000 now that just put in evidence that we are now going to face an emergency. A lot of adults being diagnosed in the 1980s are becoming adults and need to be treated as adults. If we look at the only longitudinal study being published, this is of last year, about the use of psychotropic medications in adults, this is the only study I was able to find, and it's about 286 adults, looking at them for 4.5 years, and you see that they received 64% at the end of the period. They did receive a psychotropic medication, that almost of them did use atypical and antidepressant of the serotoninergic group. And you can see that the number of medication per person increased in 4 years from 1.6 per person to 2.4 after 4.5 years. And if you look at the medication being prescribed for every person, there is a growing polypharmacy. And also, that's the most important part of all, if you look at the individuals who are taking medications, once they're started, it's very difficult to take them off. So the best thing would be not to introduce medication when it's not indicated. And once it's done, it's very difficult to take them away. I'll be very quick now on this part. because Dr. Fuentes has already clearly, and I could say really marvelously, presented all the data regarding the use of medication in this field. As he was speaking about the clinicaltrial.gov site, just to underline that the main studies anyway do remain this moment about antipsychotics, behavioral treatments, antidepressants, and dietary supplements. If we look at anyway what has been published, if we look at randomized controlled trial, we'll find this is not very out of, it's 2008, but anyway, it shows you that only 21 trials have been conducted, but with 12 medication, as Dr. Fuentes said. Too many medications, few efficacy. Even if we use all this medication, we have enormous problem with safety concerns, side effects, and Dr. Fuentes has already spoken about this. Again, just to put in evidence that the educational treatment is always the most beneficial for the people we take care of, especially if we look at the core symptoms. This just to outline what Dr. Fuentes already said. At the moment, we have only 2 antipsychotics who do have received the Food and Drug Administration permission to be, indication to be to treat children with autistic disorder, but only for the treatment of irritability, so for symptoms associated to autism, not for the core symptoms. If we look at the antidepressant, you find what Professor Fuentes just said about citalopram, but also this interesting Cochrane database, a systematic review of Williams and her group, speaking about only 7 trials being conducted on different antidepressants, with very limited evidence also in adults.